Assalamualaikum doctors, myself Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma has founded in the year 2004. We have a vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving the lives of people associated with us at all levels because we are dedicated to good health. Today, our session is part of educational activity and presentation topic is importance of nutraceutical, a neurological aspect, presented by a well-known legendary consultant neurologist, Dr. Bashir Ahmed Soomro. Dr. Bashir Ahmed is head of Department of Neurology and Neurophysiology in Dr. Zia-ud-din Hospital, Karachi. He is professionally very busy person, but always available for education. Thank you so much, sir, to join us. Dear doctors, if there is any question or query, please drop your question in chat box. Question answer session will be after presentation. Over to you, sir.
Thank you very much, Asim. Always, it is pleasure to be with you guys on educational activity. Today, I am discussing the importance of nutraceutical in our daily life, especially the neurological perspective, because I am very fond of using the nutraceutical in my patients who are having multiple chronic problems like stroke, like Alzheimer's disease, like epilepsy, like migraine headaches. So I'm very fond of, and I have tried a lot on these nutraceuticals in my 20 years of practice in neurology. So the nutraceuticals, which refer to the food or food products that provide health benefits beyond basic nutrition, and they have gained the increasing attention in various fields of medicine, especially the neurology and oncology. In the context of neurology, the outpatient departments are so busy in neurology, so one has to have pay attention to the people who are coming to the outpatient department with some additional benefit of visit with nutraceuticals. They can play an important role in supporting neurological health, and they managing their symptoms and improving overall well-being of the patient. The effectiveness of nutraceuticals may vary depending on the individual and the specific neurological conditions. This presentation is supported by the fund of Genix Pharma. So I would touch upon the nutraceutical, which can provide essential nutrients like vitamins, minerals. They may be lacking in patient diet because everyone in Karachi, they have a lot of time in busy schedule. So they lose their diet and they have a difficulty in coping up the diets properly. This is especially important in cases where the patients have a specific dietary restriction like allergies to the food or deficiencies of the some food because of the malabsorption. The nutraceutical can help they bridge the nutritional gap and promote all over the health and well-being. Neurological conditions often require proper nutrition and support of the brain health and function, because this is very important. There is a neurochemical bonding in between the neurons. Nutraceuticals can provide essential nutrients like vitamins, minerals, and antioxidants that are necessary for the optimal neurological functions. They can help to fill the gap, a nutritional gap, particularly in patients with dietary restrictions or deficiencies, or those have a overall difficulty in swallowing because of the neurological illness. The nutraceuticals play an important role in neuroprotection. Nutraceuticals may have a neuroprotective properties because of meaning they can help to protect neurons from damage, and they can prevent or slow down the progression of the neurological disorders. The examples are certain antioxidants like bacopa and huperzia, vitamin E, vitamin C, polyphenols, and the other antioxidants like they are acting as a neuroprotective agents. The cognitive function and the mental health is very important for every patient who are presenting with a neurologist or in psychiatry, because they can have so many things which are deficient. The ginkgo biloba and bacopa and omega-3, they are found in the fish oil, omega-3, and the supplements are used because to fill the gap. Nutraceutical can play a complementary role in managing the certain chronic condition. For example, cardiovascular diseases. The benefit of omega-3 is very evident, and people are using in diseases of the cardiac. And the diabetes, they can regulate the nutraceuticals, like sometimes vitamins are play very effective role. And for instance, if you use a coenzyme Q10, which is very, very beneficial in the Parkinson's disease as well as in the prevention of the migraine. And there is a well-established role of magnesium supplement in frequency and severity of migraine, where I use migraine preventive medication as a magnesium sachets. The nutraceuticals may help the poor natural, more and potentially safer alternative to the medications. So we can use the nutraceutical along with the pharmacological agents, and incorporating into the neurology OPD, it empowers the patient to take active role in their own health management. So along with the lifestyle modification and nutraceuticals and the proper medication for the neurological disorder, the nutraceuticals play a very important role. So whenever you prescribe a nutraceutical to the patient, you should think about the what are the mechanisms and how can they act. Nutraceutical can provide supportive care for patient undergoing chemotherapy, radiation therapy, and surgery. So when you आपने सुना होगा बड़े बूढ़ों से कि जिंजर सॉल्ट जो होता है वो उल्टी और वोमिटिंग को कम करता है when the patient who are developing chemotherapy on medications. The ginkgo biloba is an extract which is dried from very ancient days. This is a plant which is probably first it was invented in France, where they found the multifactorial actions of this ginkgo biloba. It is a potential cognitive enhancing effect. It has a decreasing memory loss or decreasing cognitive functions. It has a very effective role. It is also used as an antioxidant, and it is also used as an antiplatelet in stroke patients. So stimulation of how it acts scientifically. This stimulation of choline uptake in the hippocampus is done by this ginkgo biloba, and it also inhibits the atherosclerosis uh, in the brain. So it prevents the thrombosis of the blood clots in, and they block the blood vessels. So it has also an effect on the platelet aggregation. So this is as used as an antiplatelet agent along with the low molecular heparin, or you can use it along with the small dose of aspirin. So ginkgo biloba has a dual or triple response. It increases the choline uptake in the hippocampus. You know, hippocampus are very important for the patients with Alzheimer's disease, with epilepsy, with migraine, and patients with headaches. So hippocampal atrophy is well known. The ginkgo biloba stabilizes the membrane, and it's the beta amyloid deposition. It acts as a neuroprotective. Amyloid is a well-known, which is abnormal protein that is produced by the bone marrow and can be deposited in any tissue or any organ. Especially those who are suffering from Alzheimer's disease, they can have amyloid deposition. Or some patients who are elderly, they have amyloid angiopathy, and they have a small plaques in their vessels. They have amyloid deposition, and this amyloid deposition can lead to the brain hemorrhages or sometimes strokes. Bacopa. Bacopa is an herb that has been used in Ayurvedic medicine. Ayurvedic medicine is very commonly used in India, in China, in various countries. It increases the memory and cognitive functions. It may improve cognitive performance, attention, and memory retention. Bacopa contains an active compound that supports the neurotransmitter balance and protects the brain cells from oxidative stress. So it acts as an antioxidant in the. So you can use this supplement in the cognitive dysfunctioning, and it supports the cognitive health, especially those who are suffering from the Alzheimer's disease, and those who are using long-term anti-epileptic, are those who are using antipsychotic medication or antidepressant medication, those who have a cognitive decline in their life. So the scientific proof is that Bacopa increases the effect of key neurotransmitters such as serotonin, acetylcholine, noradrenaline, and dopamine. You know about dopamine is very important for our initiation of life, and dopamine is very important for our insight. The neurotransmitter are the chemical or messengers that your body cannot function without it. Their job is to carry chemical signals or messages from one neuron to the other neuron, and they reach to the targets. The target cells can be another nerve cells or muscle cells or the glands. So Bacopa increases the effect of neurotransmitter. This is scientific. Serotonin, acetylcholine, and noradrenaline. Hyperrhizia, also known as a Chinese club moss, contains a compound called hyperrhizin A. Hyperrhizin is a natural acetylcholine estrase inhibitor, which it means it helps to increases the level of acetylcholine and neurotransmitter involved in the memory and in the learning. Here I should tell you, we use this Revim medication, which is used for the Alzheimer's disease. The mode of action of Revim is to inhibit the acetylcholine receptors, and it increases the level of acetylcholine. So if you use with the Revim and Heparusia in combination, patient will benefit more as compared to the other medications like Memantine. The regulation of cholinergic system via acetylcholine result as acetylcholine inhibitors and antioxidant. So this cartoon is showing you what is a cholinergic system and its function. Cholinergic system is an important system, a branch of autonomic nervous system, which plays an important role in memory, digestion, control of heartbeat, blood pressure, movement, and many other functions. So acetylcholine is a very important playing role in the memory as well as the cardiovascular regulation. So the summary of cognitive and neuroprotective agents is ginkgo biloba, which is a stimulation of choline uptake in the hippocampus, which increases the inhibition of platelet activating factors. It stabilizes the membrane. It inhibits the beta amyloid deposition and act as a neuroprotective. So it maintains the complete brain health. It improves the circulation and heart. It reduces the symptom of psychiatric disorders and dementia. Also, my personal experience of using ginkgo biloba in sexual dysfunction is very hard, because I do use, say, in patients who have a sexual impotency because of the erections. So this is a very good medication, and you can experience. Bacopa increases the effect of key neurotransmitters such as serotonin, acetylcholine, noradrenaline, and dopamine. And Heparusia is a regulation of the cholinergic system, while via acetylcholine result in AC stress inhibition, and it acts as an antioxidant. So it improves your thinking, learning, memory, and it helps to sense of calm and maintains the mood stabilization. These are the few papers which are meta-analysis of efficacy and safety of the ginkgo biloba extract for the treatment of dementia. So I would recommend you, if somebody who is presenting with a sudden amnesia, you should consider to start these medications. The uniqueness is it has a scientific effect. So the supernatural and ingredients which are very important for the brain health is a vitamin B12, which improves daily activity and performance, and it also reduces the homocysteine level. So it prevents the strokes in young patients. It prevents heart attacks in the young patients. And the B6 or B9 and B5. These are very important B complex, and they boost the energy and the effect of aging, reducing the fatigue. And the zinc. Zinc is a boost immunity agent, which is improving the immune system. So B6 improves the skin, hair, and nails. So improve your mental health and performance, regain your energy and memory through these minerals and medications. So the booting up your brain is important because you can have these type of medication which are very available in our society. And thank you, Genix, for these 10 content of the MEMOR are ginkgo biloba, bacopa, L-glutamine, zinc, curcumin complex, B12 complex, extract heparusa, B6, B9, and B12. This is a main combination. And I tell you, I have started to take these medications to improve my memory and sexual life. Thank you very much for the time.
Bundle of thanks, sir. Wonderful presentation, and thank you so much to give your precious time, sir, on your valuable support in our new molecule and new combination of nutraceutical pharmaceuticals. Sir, we have some question in chat box.
Yes.
Sir, what would be recommended dosage of this medicine, that is MEMOR?
MEMOR is recommended, especially those who are using MEMOR. They should take 1 BID in the form of MEMOR.
Can we give this MEMOR with anti-epileptics? Is there any benefit?
Yes, there is a benefit because the anti-epileptic medication, they reduce your cognitive functions.
Can MEMOR use with other coagulant drugs?
Yes, one can use the with small doses of aspirin also.
Thank you so much, sir. I hope for such nice presentation, just like me, all doctors and participants enjoy this session. Thank you so much, sir, for your valuable time. Thank you, sir.
Thank you. You are welcome always.